welcome to a new Top Doctors interview. Today, I am delighted to welcome Mr. Simon Brewster, esteemed consultant urological surgeon with practice in Oxford, who will talk to us about good medical practice and the role of a doctor. Hello, Mr. Brewster. Thank you for joining us. How are you today?
Good morning, Carlotta, and I'm very well, thank you.
Perfect.
Nice to see you.
Before we dive into the questions, would you like to start by telling us a bit about yourself and your trajectory?
Thank you. I am a consultant urologist. I work in Oxford, UK. My training was in London and then in Bristol before I came to Oxford 24 years ago to become a consultant. My special interest has always been prostate disease, both benign and malignant, and I have written 90 papers and done some work with the National Association as well as a European Urological Association group. So currently I work part-time for the NHS and work some private and do some teaching for Hertford College, which is in the University of Oxford.
Lovely. We'll get right into today's topic then. The first question is, with more than 30 years experience in clinical practice, Mr. Brewster, you have seen and cared for patients from many different backgrounds. What is the most important thing to have in mind during a consultation with a patient? Do you focus first on their story, their medical history, their concerns?
Yes, well, I think the most important thing to focus on with a patient is why they're coming to see me. Always polite communication and trying to work out through careful history taking and examination how I can help them best once I have worked out why they want to see me. Sometimes the reason for them seeing takes a little bit of teasing out, and it may not be initially particularly obvious.
Mm-hmm. And in that communication, how do you manage to communicate effectively with patients with a variety of ages and needs?
Yes, well, some patients are hard of hearing, and other patients have poor sight. It's extremely helpful nowadays. We're wearing masks less, and so patients that don't hear terribly well can often struggle if one is wearing a mask because they can't see your mouth moving. So that makes communication more difficult. We're wearing masks a little bit less now in some clinical settings, which is good. And so I communicate by talking, and if necessary, I make diagrams or use a model. For example, here I have a model of a prostate gland and its relationship to the bladder and the urethra. And a lot of patients who come to see me don't fully understand, and it's quite reasonable that they don't understand where the prostate is, what it does, how the urine comes through it, rather than around it, for example. And so I use this model in the clinic to show them and to also to illustrate what I can do to help in terms of removing or shrinking it.
Mm-hmm. And what is the most rewarding aspect about being able to help elderly patients, especially?
Yeah, well, a lot of my patients are on the older side. I have middle-aged patients as well. Sort of unusual to see patients with prostate problems under the age of 35 or 40, but most of my patients are, I would say, in their 70s, with a few in their 60s and a few in their 80s and 90s. So I suppose the most rewarding aspect of my job is being able to tell them with fair confidence that I will be able to help them to pass urine, particularly ones that can't pass urine at all and are dependent on a catheter, which is a tube that goes up the urethra and drains the bladder. So I can do operations that can help patients get rid of their catheter, and that is a major thing for their quality of life. Having a catheter is no fun. So I think that is really quite a rewarding thing, and I see the results. Obviously, I look after them before and after the operation, and I like to see them smile.
Perfect. And in your area of specialty, especially, one's bedside manner seems to be a core aspect. Why is it important to have a good bedside manner, Mr. Brewster? And what do you think your patients value most about your own?
Well, having a good bedside manner puts the patient at ease and gives them confidence. And it really is all about communication and kindness and understanding. I think it's a very important aspect of the doctor-patient relationship. I like to do as much consulting as I can face-to-face, and again, that with COVID beginning to pass its most dangerous phase, it's much more possible to do face-to-face appointments, and when you can really communicate verbally and with non-verbal communication much better than you can, I think, over the telephone.
And after, sorry?
No, well, I was just going to go on to say that having a good bedside manner reduces the likelihood of patients becoming upset and complaining about their care.
Lovely. And after all these years, what drives you to keep ensuring an excellent standard of patient care?
Well, I want to keep patients coming to see me, and I think as my experience has accumulated over the years, I can do a better and better job for them, honestly. And I'm pleased to say that I've never as yet had to handle a serious complaint against me for any care issues. So I would like to keep that going until I fully retire, which will be in a few time.
No. And is this what you keep in mind when you face difficulties in your day-to-day work? How do you handle these difficulties?
Well, difficulties with patients are, I think, often about communication. That they can become frustrated if they're having to wait for an appointment, or have difficulties making an appointment or getting a result, and so obviously if there has been any kind of delay or administrative issue, I'm very apologetic and try to see that doesn't happen again. If it's a difficulty with conduct in the operating theatre, then it doesn't involve the patient. It involves my communication and decision making with the theatre team. And if an instrument breaks, for example, I have to occasionally produce some sort of ad hoc plan to get the patient out of any potential difficulties and finish the operation, which again, having lots of experience helps with. And then post-operative complications that the patient may find difficult, providing them with reassurance and having consented them carefully before the operation and warned them that things can occasionally go wrong, and with specific examples and percentages and this sort of thing is very important, so that the patient is prepared for any difficulties they may face, and that they know that I can help them relieve the difficulties, if you like.
Mm-hmm. I'm sure your patients feel very relieved after having a conversation with you. Yes,
I hope so.
I am sure of that. And those were all of our questions, Mr. Brewster, for today. It's been really lovely to have you, and I would like to thank you for taking the time to come and talk about what good medical practice is and what is the role of a doctor and how a doctor can help a patient feel better and have a healthy life.
That's very kind of you. Thank you for taking the time to ask me those questions.
Mm-hmm. I would also like to remind our audience that if you require Mr. Brewster's expert care, do not hesitate to visit www.topdoctors.co.uk, where you can find out more about Mr. Brewster and you can book a consultation with him. Thank you again, Mr. Brewster.